Sarah Ferguson's been diagnosed with skin cancer just months after being treated for breast cancer.
Yes, this diagnosis comes as she'd had several cancerous moles removed. A spokesperson for the Duchess of York has said she's undergoing further investigations to ensure that it's been caught in the early stages.
Well, let's now speak to our royal correspondent Cameron Walker, who's here. This is another tale of royal woe as regards health. We believe, though, it augurs well for Sarah Ferguson?
Yeah, fingers crossed. The doctors are looking at it to see if it's been caught early enough to treat. If you remember the last time you saw Sarah Ferguson in public, it was on that Sandringham walk on Christmas Day. We hadn't seen her take part in that walk with the rest of the royal family for around 3 decades. And according to the Telegraph this morning, it was just a few days after that walk that she was diagnosed with skin cancer, malignant melanoma. As you said, Isabel, it was as they were treating her for breast cancer that they decided to test a few of these moles. She's understood to have gone to a very exclusive medical clinic in Austria to seek recuperation and treatment, but she's now back home in Windsor at Royal Lodge, surrounded by family. Her spokesperson says she's in good spirits, but of course, understandably, this is distressing. She has a family history of skin cancer as well. Her father was diagnosed with skin cancer just a few months before he died. But as I said, it appears to have been caught early enough from what we've been told by her spokesperson, so we'll have to wait and see.
Cameron, 2024, a bit of an annus horribilis already, and here we are only on the 22nd of January. But, you know, they come like buses, don't they, these royal medical stories, and it's not good.
I know, and this time last week I was just saying, why is it that we haven't seen senior members of the royal family out and about doing engagements? And then, of course, on Wednesday we find out the Princess of Wales has gone into hospital for abdominal surgery. She's out of action in hospital for the next week or so, followed by 3 months convalescing in Windsor. The Prince of Wales out of action because he wants to support his wife and children. And then, of course, the King at some point this week will be going into hospital himself for an enlarged prostate. But with the Duchess of York and the King, they have both chosen to disclose what they have wrong with them. And that could potentially have a big impact on the whole country, because people who perhaps wouldn't have checked their moles in the Duchess of York's case, or indeed checked symptoms of an enlarged prostate, now may well seek medical treatment. The NHS website, when it comes to enlarged prostate, it's gone up 11 times the amount of views to that website, which equates to 1 every 5 seconds. So it could help a lot of people.
But, you know, with the loss of Harry and Meghan, they've gone off to the States. You've got Prince Andrew out of action for obvious reasons. And now we've got a lot of these senior royals convalescing. Do you think this makes the case for a slimmed-down monarchy a bit more flimsy? Do you think the King might be rethinking it?
Well, the Princess Royal certainly thinks so. You remember the interview she did on Canadian television around the time of the coronation. She said the idea of a slimmed-down monarchy made a bit more sense when there were a few more people around. We have lost many members of the royal family over the last few years for various different reasons, and people are going to have to start picking up the slack a bit. The only senior royal still in action at the moment is Queen Camilla, who perhaps will be out and about this week, but then we have less senior members of the royal family, the Princess Royal, the Duke and Duchess of Edinburgh, the Gloucesters, but then Princess Alexandra and the Duke of Kent, for example, they're both in their 80s, and they're getting increasingly frail now.
What about Sarah Ferguson's daughters? Do they come into the rankings?
Well, they certainly have their own patronages and causes they support, but the problem with those two is that they're not officially working members of the royal family. They're privately funded, and unfortunately for them, their father is the Duke of York, who is, of course, disgraced. And unfortunately, the problem for the King and the courtiers around them is that that tag is always going to be with them, regardless of the great work they do. So it's a tricky situation for the King. Perhaps when Prince William comes to the throne and he's got his 2 cousins by his side in the absence of his brother, we may well see them take up a bit more royal duties, but we'll have to wait and see.
And meanwhile, a worrying time, I suppose, with Sarah Ferguson. She's got that lovely red hair, so freckly, and I obviously remember growing up, I think one of my first ever books was the royal wedding between her and the Duke of York, and I was obsessed with her when I was little. But she loved the sun worshipper, and of course famously pictured toe-sucking, wasn't she? Always sunbathing. But, you know, this is the bad...
in fairness to her, she wasn't toe-sucking.
Oh, right, OK, right. Well,
he was toe-sucking.
OK, I trust you to remember the specifics.
He had her toe in his mouth.
Right. OK, nevertheless, she was in the sun.
Yeah.
And my point being, she's got the bad skin cancer, so it is a worrying time.
Yeah, and according to the NHS website, the main cause, as you said, is ultraviolet lights, and she has been pictures a lot, on sun lounges, and she's got red hair and freckles. Again, according to the NHS, that is a sign that you've increased your risk of developing this type of skin cancer.
I'm so glad you're in the studio today talking about things. I mean, imagine if you were that lovely coiffured hair of yours. I mean, would be everywhere.
In the wind.
It would be all over the place. I need a lot of spray.
All over the place.